Hello, my name is Rachel. I'm a registered nurse for 14 years. I'm making this video for my application to St. Catherine's University, the Adult Gerontology Primary Care Nurse Practitioner program to start this fall, September, I believe, of 2024. So I'll just jump right in. It looks like, what type of clinical experience do you have? So I started my career on a med-surg floor in Sioux City, Iowa as a new grad. Worked there a couple of years and moved to Minnesota and went straight into post-acute skilled home care for Fairview. So I worked out of the Minneapolis branch and I jumped right into in-home, hands-on, high acuity skilled care patients. So we had a lot of patients, the majority of them discharging from the University of Minnesota on the East Bank, which came with all different type situations, post-surgery type stuff, organ transplants, oncology patients. So just a wide array of very unique, I would say, medical diagnosis and high acuity patients. So I did that hands-on care for quite some time. I worked in a leadership role for the past 3 years there before I left in September of 2023, just overseeing the leadership role, the next level leaders of our field clinicians, that being physical therapists, occupational therapists, social workers, home health aides, and of course our RNs and LPNs. I really enjoyed that work. I like the leadership aspect of professional nursing. However, I made a change to my career as far as nursing goes. And last September, I transitioned back to the bedside at Mercy Hospital, where I'm in the float pool. And I'm also currently almost done with my cross training to the emergency department, which I am so excited about. I have about 6 shifts left and we'll be done by the end of July. And then I'll be out there in the emergency room by myself, which I'm super excited and ready to jump into. And the reason I made the transition back to the bedside and inpatient care is, for one, I needed to decrease my hours of working. From a leadership position, it was 40 plus hours a week. And for me to complete my bachelor program, I needed to make some changes to allow time for me to do schoolwork. So I jumped to a 0.6 position. I'm working at Mercy and I love it. I love patient care. I love every aspect of being a nurse, to be honest. But I've just, it's just reaffirmed my goals of wanting to be a nurse practitioner, being back at the bedside with the patients and, acute situations, because it is a hospital, and that they really need the care. And I just love being a nurse. And I can speak from a personal standpoint. My empathy is overflowing. I've journeyed the past several years with my husband, going through a major health issue requiring open heart surgery in the end. And just knowing and feeling and being the wife and the caregiver of somebody who requires some pretty extensive care has really catapulted me into where I want to go with my nursing career. And it also has just given me the empathy that I think all of us nurses need to practice care and care for patients, to know how others are feeling, know how our patients and our families are feeling too. It can be a really emotional journey and it can be very challenging, but it can also be very rewarding. So that is that. So what qualifies about the St. Kate's mission, or what qualities about St. Kate's mission and values attract you here? I just like the holistic approach, the social justice, ethical, and holistic education that St. Kate's mission is. My role and my desire is just to enhance my leadership and clinical skills, to practice professional nursing from a DNP standpoint. Some strategies I have as far as being successful in the graduate program there at St. Kate's is just effectively managing my time. So I've already made some reductions And then I do plan to go to a casual position with my work, so school can be the priority, and I am as well. As I mentioned, I'm a mom and I am a wife, so that it really is my number one, and then school will be definitely requiring all of my time. So between those two things, I'll go to a casual status. I'm a quick learner. I'm very quick on my feet. I feel like I have a good amount of knowledge and background from the nursing clinical aspect. So this would only enhance and help me grow to be into a better nurse where I can practice my nursing just from a different standpoint. I strive to live out nursing type qualities. I don't just preach it to patients how to live a healthy lifestyle. I do that myself too, holistically, mind, body, and spirit. I am into wellness, nutrition, good sleep, practicing good daily life skills that would make me thrive, so I can be the best that I can be for those that I need to be the best for, which would be my family and for school and just life in general. I'm all about being my best. So I think I have answered all of those questions. What motivates me to become a DNP prepared nurse practitioner? It's my patients. It's the patients I care for and my desire to just want to uphold the nursing profession. And again, being on both sides of things, I think that is really, really just motivated me to want to advance. So I'm just so excited, and I look forward to hearing from you guys. And I'm ready to start. I turned 41 just the other day, so I thought after 40, if I'm not gonna do this, I'm not gonna do it. But actually I meant if I'm gonna do it, I should do it now. I'm not getting any younger. I have a long working career left, but I'm in a right time in my place to return back to school and really focus on things. So I'm excited. So thank you so much. Bye-bye.